Today we're going to be doing our NG tube checkoff. The first thing that we're going to do is our 13 safety practices, which are to verify the care and order for the client, wash hands before and after any client care or whenever handling any supplies, verify policies and procedures at the facility you're working, consult manufacturer recommendations regarding the use of their supplies. You're then going to knock on the patient's door. You're going to walk in and introduce yourself. You're going to verify the right patient using 2 patient identifiers such as name and date of birth. You're then going to note the overall condition of the patient. After you do this, you are going to provide for privacy and explain the procedure to the patient. After you've done this, you're going to raise the bed to a level for good body mechanics. Once you've done this, you're going to don any PPE that is indicated for the skill. Following the skill, you're going to remember to lower the bed into low position. You're going to apply the side rails per the care plan. You're going to place the call system within reach. And then you are going to remember to notify the primary nurse of any abnormalities. You're also going to remember not to give any IV push medications without the instructor present. I know we're not really giving medications today, but we are giving a solution, so I'm going to go ahead and say my 6 medication rights. Those are right drug, right dose, right route, right time, right patient, and right documentation. All right, our first order is to insert this NG tube, and we're going to set it to low intermittent section. So what I'm going to do here is go ahead and grab the tube, put some gloves on, wash your hands, all that good stuff. Okay, I have opened the tube and set up my lubricant, and I have my tray here to do lavage and gavage. It's all set up. Everything's within date, everything's normal, no damage to the supplies. And the next thing we're going to do is we're going to measure the tube to determine where to place it. You're going to measure from the tip of the nose down to the patient's earlobe, and then down to their xiphoid process. And then you're going to mark on the tube with a pen. That way you know how far to go when you administer it. You would also want to do an abdominal assessment on your patient and listen for bowel sounds. You would also want your patient to occlude one side of the nose, so go ahead and do that. Now breathe in and out. Now your other side. You would want to assess if they've had any injuries to their nose, any septal deviation, anything like that. So once you determine which nair is the most appropriate, you're going to go ahead and administer the NG tube or insert it. You're going to want to put lubricant up the catheter 3 to 4 inches. Make sure your patient has their water. You're going to have your patient tilt their head back. You're going to insert it into the nair, and you're going to run it up until they start gagging or you hear their gag reflex. All right, you can tilt your head forward, and you're going to continue to insert. While you're inserting, ask them to sip their water and swallow. Help it go down. And once you've reached your spot, I'm going to have you hold that there on your nose. You're going to go ahead and anchor it into place. If I can get the tape to work. Okay. And then you're going to want to verify the placement of this. Per the facility policy, you can do, well, it ain't going to stay on there. Alright, now that that's on there, you're going to verify placement. You can either do this per the facility policy. You would either do an x-ray or you would go ahead and draw out some contents from the abdomen and you would do the pH testing on it. Then once you verify your placement, you're good to go. The next order that we had was to apply this to low intermittent suction. So how you would do this is you would have your end here, you would have it unclamped, you would hook it up to the suction on the wall and make sure that it's on the right setting for low intermittent suction. You're going to look at the contents that's coming out, the amount, the consistency, the color, all that good stuff. So that is suctioning. Our next order is for us to do lavage. What we're going to do for that is we're going to have 200 to 300 mLs of normal saline. Physician wants us to do it with 0.9% normal saline. And how we're going to do that is we're going to draw up some normal saline in our piston syringe here. We're going to make sure that our device is unclamped. We're going to put it in, and well, before we would do this, we would check bowel sounds, make sure that that's functioning well. And then after you do that, you're going to assess for bleeding in the stomach, how heavy it's bleeding, things like that. And then we're going to irrigate and pull back. And then you would have a place to discard. And then you would just do it again, irrigate, get more saline, irrigate again, and pull back. And you're going to do this over and over until the solution has no clots and it is not any blood. It's clear return. And that is our gastric lavage. Our last order was for us to administer Glucerna 1.5 calorie, 100 milliliter with a 50 milliliter water flush. As long as the residual is less than 150. Also, after you do your lavage, you want to make sure that everything is capped off again. So our next one, we're going to do our Glucerna. The way we're going to do this is we are first going to assess placement again. With all of these, before lavage, you always assess placement. You want to make sure that it's in the right place. You do x-ray, you do contents, testing the pH. It depends on the facility and exactly what skill you're doing. Their policies is what you would follow. So we've made sure that it's in the right place again. We're going to do an abdominal assessment, listen to our bowel sounds, and make sure they're there. The next thing I'm going to do is I'm going to go ahead and check residuals. All right. Grab my tube here, uncap, and we would pull back until we get however much residual out. Now that we've checked residual and confirmed that it is less than 150, we can go ahead and give our Glucerna 1.5 cal. So the first thing you're going to do whenever you get that is you're going to draw up 50 milliliters of water. You're going to flush. And also, with it being less than 150 of residual, you would go ahead and just put that back in the stomach. Okay, and now that we've done that, we've flushed before it, I'm going to go ahead and just remove this. Now you can do the feedings without the actual syringe part. And then you would have your Glucerna, you would check the integrity of the container. You would check that everything was correct, make sure it was clean, not damaged. And then you're going to hold it no more than 18 inches above the insertion site, and you're going to pour in the 100 milliliters. You're going to let it drain into the stomach. And once that's done, I'm going to go ahead and clamp that while I go ahead and prepare to flush it with 50 cc's of water again. I'm going to draw up 50 cc's of water. And clamp. We're going to flush that. We're good. Let's clamp it back off. And that is gastric gavage. The big thing is just remembering before all of it, you need to check placement. You also need to do your abdominal assessment and make sure they're having bowel sounds. And I believe that encompasses everything in this skill. Thank you.